as our panelists, as the program unfolds. My name is S.C. Ogenovo, and I'll be the moderator for this session. Joining me is a distinguished panel of experts who will bring a wealth of knowledge, experience, and compassion to this discussion. So let's stay tuned and keep our fingers crossed and open our minds and join the conversation, because every story matters and every mind deserves care. So now let's quickly launch into the business of the day by introducing some of our panelists. I will start with Dr. Umfom. Dr. Umfom is more like a member of the house because he's facilitated a lot of programs with ICTMH, and we've really enjoyed her presence and felt her influence in ICTMH. Dr. Umfom Basi is a distinguished environmental chemist with a PhD in environmental chemistry. Okay, so there was a little pause there. So I will start by introducing the panelists. I will start with Dr. Umfom. I said Dr. Umfom is a distinguished environmental chemist with a PhD in environmental chemistry. She began her academic journey with a degree in applied chemistry from the University of Calabar and gained nearly a decade of professional experience at Tricon Project Limited, an oil and gas servicing company. She later obtained her master's and doctorate degrees from the University of Uyo, and she also holds international certification from the Global Women Management USA. With over 6 years of lecturing experience, Dr. Basi has published widely in reputable journals, including the Asian Journal of Geological Research. She is a member of the Chemical Society of Nigeria and the American Chemical Society. Beyond academia, Dr. Basi is an inspirational speaker known for her expertise in emotional intelligence, social intelligence, and joyful parenting. She has featured on talk shows and participated in several conference and training programs. A strong advocate for women empowerment, she serves on the boards of the Gidas Foundation and the Iyene Basi Women Association. Dr. Umfom Basi, we are so delighted to have you here today.
Thank you for having me.
You're welcome, Doctor.
Thank you for having me. It's everyone.
Yeah. Thank you very much, Doctor. So we would quickly launch, move to the next person, the next guest, and this is Chinicherim Favor Paul. Chinicherim Favor Paul. She is a dedicated psychological guidance counselor with a strong background in psychology and mental health research. She holds a bachelor's degree in psychology from James American University and a master's degree in psychological guidance and counseling from Near East University, where she graduated with high honors. She is currently pursuing her PhD in psychological guidance and counseling at Near East University. Over the years, Favor has provided counseling and emotional support to students and individuals, helping them navigate challenges related to anxiety, stress, emotional distress, career guidance, and personal growth. Her professional experience spans counseling roles at the University of Kenya and private practice, where she conducts both individual and group therapy sessions on-site and virtually. Beyond her clinical work, Favor is a passionate researcher and an author. She's published scholarly articles on psychological resilience, academic and burnout, and career choice. She's also the author of Knowing Self, which she wrote in 2002, and Cradle to Crib, books that were published, books that reflect commitment to personal development, emotional balance, and family wellness. Dr. Chinecherin Paul, you're welcome, ma.
Thank you very much. Thank you for having me. Thank you all. Thank you.
Great. I'm not sure, Mr. Emil, if our chaplain is present. Is chaplain present, Mr. Emil?
Yes, yeah, I'm here.
Okay, great. Oh, great. So our third panelist is a very important guest that has a lot of color to himself, and we're really pleased to have him. He's Chaplain Colonel Vianney. And Chaplain Colonel John Vianney Ijeoma is a distinguished Catholic priest and a military chaplain whose life of service spans continents and cultures. Born in Aba, Nigeria, he was ordained in the Catholic priesthood in 1988. Driven by a profound commitment to ministry, he came to the United States of America in 1997 as a missionary to the Diocese of Lake Charles, Louisiana, where he responded to the pressing need for clergy. In May 2004, he answered another call to serve, this time as a U.S. Army chaplain, embarking on a career marked by compassion, leadership, and resilience. Over the years, Chaplain Ijeoma, or Reverend Father Ijeoma, as I would probably want to call him, has served in diverse assignments across the United States, Europe, and Asia, and deployed to combat zones in Iraq, and Afghanistan. His dedication to both spiritual and care and professional excellence has earned him numerous awards, including 2 Bronze Stars and multiple meritorious service medals. In addition to his military education and accomplishments, he holds a bachelor degree in philosophy and a master's in theological studies. Today, having risen to the work of Colonel, Chaplain Ijeoma continues to mentor and train the next generation of chaplains while embracing his hobbies of traveling, cycling, and bird watching. His story is a testament to faith in action and the enduring power of service. Reverend Father Ijeoma, yeah, welcome, sir.
Glad to be here. Thank you all for having me.
Thank you very much, Father. So we are really happy to have our panelists, and we are very confident that we are going to unpack this very important topic. They will help us to do that. And the topic, once again, as a reminder, is mental health in humanitarian emergencies. So we're going to take off by asking a lot of questions, and of course, our panelists are here to give us the answers and shed light on what we need to know. So I will start with the first question that should be going to Reverend Father Ijeoma. You probably would have said ladies first, but this time around, let's start with the gentleman, Father. Father, so this question is going to you. So what are the unique mental health challenges faced by populations affected by humanitarian emergencies? Let me repeat that question, please. What are the unique mental health challenges faced by population affected by humanitarian emergencies? Father, you have the floor, please.
Okay, thank you. As
Welcome.
soon as I saw the question, my mind right away will go to the situation in the world today. So we have Gaza, we have Ukraine, and also part of us also in Nigeria, we have the northeast of Nigeria, where soldiers also have soldiers, airmen, and Navy personnel have also been deployed to help to bring peace, or maybe in war zones. So the things that occur to me is that, the challenges is that we have people now with trauma, PTSD, depression, and anxiety. So those are the challenges, and then lives are disrupted so that, usual things that they do in lives are being disrupted, and also it affects children, it affects women, girls. So those are some of the things that kind of happens in places that are war, the health issues or the mental challenges that we do have. So trauma, we know when there is war in a place, it could also affect both those who are at war or those who are even fighting the war themselves. So the challenges then will be that because they are in a place where there is war, it could also, we do not have people to take care of them. Just as, if you think about mental situation or mental health in the United States, where there is, maybe a stabilized world, when you call 911, most likely you have an ambulance that comes up, you have a police escort that comes, and you have firefighters that come. So, but in a situation where the population is being affected by humanitarian emergencies, you may not have anybody. So the challenges will then be that people will have to do it themselves, however they can. So, and then it kind of lingers. So those are some of the things that I think about. So,
Okay.
and then you have girls and women who maybe face a situation like rape and all that, and these also will, be a mental challenges for them.
Thank you very much for that response. It's quite an emotional one, because especially the mentioning of the impact of these mental aids related to emergencies, related to women and children. Like the last thing you mentioned is quite pathetic and emotional to hear this. We'll proceed to the next question, which would go to Dr. Chinichirim. So, Dr. Chinichirim, how can humanitarian responders effectively integrate mental health support in emergency response plans? How can humanitarian responders effectively integrate mental health support into emergency response plans?
All right. Thank you very much.
You're welcome.
So most times we see that when there is an intervention on emergencies, we talk about the mental problems later. So most time people focus on the physical problems, the physical symptoms, what they see, and how they can manage the situation physically, right? And they neglect the mental health of those who are affected, and hope that they would get the mental help they need after the intervention is done, after they've treated them, after they, gone to know what the problem is, the emergency is with the people. So for there to be a successful integration of mental health in emergency response, it has to be part of the plan of giving the emergency. So when respondents are going for emergency situations, a mental health practitioner should be part of the team, which will administer some mental health help to the people who are affected in the situation. And another thing is, this help shouldn't be something that is a short-term goal. Okay, we look into your case and we try to find a way to make you cope with what has happened to you. But afterward, what's the next plan? What are we expecting the person to do? How are we expecting the person to cope with what has happened? It can be a traumatic event, and the person will need constant guidance, at least for a while. So a long-term support would really go a long way in getting people to welcome the mental health program after emergencies happened, So that would be an effective way to integrate it into the response plan. So make it a plan and then make it a long-term goal. Yeah.
Wow, great dimension. It's actually quite thoughtful. That angle is actually new, that not only should other part of intervention done in this case, but the mental health part should be factored into it, and it should not just be for a short while, but for a long term. That's a very fantastic dimension from nature. So I would proceed to the next question, and that should be for that question is still going for for Nechen. Madam Nechen, this question is still for you. It's, a follow-up question on the second one. So, what are the most effective culturally sensitive interventions for addressing mental health needs during crisis? Because you just mentioned the fact that mental health intervention should be done, but now we are looking at what are the most effective culturally sensitive interventions for addressing mental health needs during crisis?
Okay. Like I mentioned earlier, a mental health practitioner should go with the respondents in an emergency. But something that it's highly sensitive that should be thought about is who should go for these interventions. Because some people, especially when they are not very welcoming to mental health or mental health respondents based on stigmas and all that, they may not want to be open, to just anybody. So when someone who possibly speak the same language like them, somebody who understand their cultural background, somebody who they feel that can be close to understanding what they feel based on cultural relationship, that can help people be more open to even discuss sensitive matters when trying to intervene in their situation. So I think this is one of the, if not the most effective way, is to get someone who understands them. Because if you're sending someone who doesn't speak the same language as them, who doesn't speak the same environmental language as them, they might hold back their information or hold back their openness to you. So I think this is the most effective way to get them to talk during crisis, to get someone who understands. Yes.
Absolutely. Thank you very much for that beautiful perspective, Nature. So we'll go to the next question, and that would be for Dr. Mfombasi. How does the stigma surrounding mental health impact access to care in emergency settings? How does the stigma surrounding mental health impact access to care in emergency settings? Dr. Mfom?
Okay, thank you so much.
Yeah.
When we talk about stigma, there are different, types of stigma. We have the cultural stigma. We have self-stigma, where somebody feels, oh, because this has happened, I have to hide myself. I don't want to be I don't want to be out there. I don't want to be thrown under, Like in the cultural and social stigma, many communities, interpret mental health distress or mental distress as demonic, as an act of witchcraft, so that makes people not want to come out because they don't want to be tagged as being a mad person. The community generally will look at it, oh, this person is mad, when you have a mental health issue. So a lot of people don't want that stigma, and that makes them to hide. That makes the community to hide because they don't want their community to come out there as a community that hosts maybe mad people and all that. So there is also the fear. I said earlier, there is also the fear of, self-stigma, where affected individuals feel ashamed to admit that they are in distress because they are trying to hold it together, even when it is not, the center isn't holding. So they believe that it means they are weak or incapable. And that makes them, that affects the way they come out to, access help women survive, for example, women who survive gender-based violence, they don't want that stigma. They don't want that to be, tagged on them. So what do? They go into hiding. We also have the fear of discrimination or exclusion, especially in the social sector. People fear the loss of their social standing, their jobs or marriage prospects if labeled with mental illness. So a lot of people will just, shy away. Men would want to hide. Men in camps would want to hide. They don't want to be seen as, having mental health challenges. Of course, we also have the stigma that comes from the health workers themselves. So the service stigma and then that limited trust. So health and humanitarian staff themselves may hold stigmatization attitude, which make people shy away, which make people shy away from, coming out for help. So a lot of things. We have the gender-based stigma, we have organizational stigma, we have structural barriers. A lot of things come to play. So people don't want to be tagged either mad. People, for instance, who were raped, they don't want that associated with them because they feel it's going to affect them, especially in the marital sector. You understand, in marital way, people will just like, when we say somebody wants to get married, for instance, the first thing we'll do is to do a search. And one of the searches that is done, especially in our country, culturally, is to check out the health background of the family the person wants to marry into or marry from. And one of the things is to check the mental health. And when we talk about the mental health, we're not talking about like mental health issue as we know it, right now. They're talking about, oh, is the person mad? Sorry about that. My lights, they're trying to fix it. So, so people don't want to come. So the stigma, he just keeps people back. The stigma makes people to coil into their shell. The stigma makes people not to want to even hear that there is help somewhere, So it goes a long way. It makes people to coil up. It makes people to hide even the way they are feeling. Even when it is detrimental to them, people don't want to speak up. People don't want to own that this is actually happening to them. Why? Because they are afraid of being stigmatized. So it is really a hindrance to accessing timely help. So a lot of times, because they are hiding, the situation goes from bad to worse before, when they see that everything has gone out of hand, everything has gone down. And that means at the last stage, that's when people begin to seek help because they can't run anymore. They can't hide anymore. So that's one of the things that stigmatization does, in keeping people away from accessing not just help, but timely help.
Wow. Thank you very much, Dr. Mfom. You've really helped to demystify how stigma can be a strong barrier to people accessing it with all the examples you gave. Thank you very much. So let's go to the next. Let's go to the next question, and that will be addressed to Colonel Ijoma. Prioritization and integration. This question has to do with having priority and integration. So how can mental health and psychosocial support be effectively integrated into the initial emergency response phase? And what are the primary challenges to its prioritization by humanitarian organizations and donors? I don't know if Reverend Father got that question. Should I repeat it? It's a two-way question.
I got it.
Okay, thank you very much. Or you can proceed further.
So I see the question in two ways. One is about the mental health, how the effective integration into emergency response, and another one will be the primary challenges and prioritization. So so it's important to really understand that mental health, like we said, it's like somebody having headache. It's just another health condition. So it's a health condition. Just as we have integrated a lot of health conditions in every part of our lives, we also need to make sure that people understand that mental health is another medical condition. So Having said such, then when we train frontline workers, emergency response people, we should also train them to understand what mental health as one of the, health conditions, so that they will understand what it means. Okay, and then also, knowing that Dr. Mfon already mentioned it, some of the stigmas which could also go with culture. So supporting communities and making sure that, they understand that somebody who has mental health should not be ostracized. So, supporting them, and because, some certain mental health in families, when people have such mental health in families, they are abandoned. And also people are ostracized because they have such people in their families. So it's important that we also understand that in the integration, and prioritizing also mental health in everything that we do in our lives. So, such as, we know that a lot of people have headache or stomachache, and there is need that when you get to a pharmacy, that you'll be able to find Panadol or paracetamol and all that. So, making sure that there are also ways to have these people taken care of if people have mental health issues. The other question is the primary challenges. The primary challenges in this prioritization. I see there is, there is a lack of political will and recognition. So even in the higher ups in politics, in some areas, people don't understand it. I made mention about, developed world, where people understand it, and whenever they, portion medical issues, they are able to put that as part of it, so that even those who have mental issues, they have nurses who go to their homes to give them medications that they need, that they require every day. So, but in some places, funding are lacked. There are no much funding that is given to places that do not understand what mental health is about. So there is challenges like that. And also there is a persistent gap between research and practice, and a lack of adequate training or trained staff as far as mental health is concerned. So in some hospitals, thinking about in the military hospitals, for instance, in the US, there is always in every clinic there is a behavioral health. So we hope that some situations, in some places, that people include such things in their different clinics and hospitals, so that mental health patients could also be taken care of. Thank you.
Thank you very much, Father Ijoma. That was a very powerful. Those were powerful recommendations that I just really hope that we can really cascade this information down to all stakeholders, and can make use of them to really help in solving mental health challenges. Now let's go to the next question, and that will be addressed by Dr. Umfombasi. So we're looking at addressing the spectrum of need. So the question would be, what are the distinct mental health needs of affected populations? For example, children, women, refugees, displaced persons, and how can mental health providing services be tailored to the culturally sensitive and accessible to all? Dr. Mfon, please, can you hear me? Dr. Mfom, seems you're muted. Hello, Dr. Mfom. Can you hear me?
I think the light is still being fixed. I'm sorry about that, but you can hear my voice, right?
We can hear you, yes. You probably can, you can switch, yes. Okay, you can put your video off and maybe come back with your video.
Yes. So addressing the spectrum of needs, spectrum of needs. When we talk about the humanitarian services, as it has to do with distinct mental health needs of different affected populations, the way children are affected is different from the way women are affected, other refugees, men, and all that. So it touches one in different ways. And sometimes, when especially like children, I just got to know, that children grieve differently. Children traumatize in different ways. So we'll take it one at a time. Let's look at how it affects the children, like the children and the adolescents. I'll just group it together for lack of time. For instance, what the children need is emotional security and stable caregivers. Children need to know that there is someone there for them. Children need to know that somebody cares, you understand, and that whatever it is they feel is being taken into consideration. You understand? They don't have to, oh, you're a child, go and sit down somewhere. You understand? In time past, that was the case. When you just tell a child, what, go and, go and sit down somewhere. Let big people try to see how to solve the problem. But the child is also involved. She's also facing it. Whatever it is the adults are going through, children also go through it. Okay? For instance, when a lot of this displacement and everything happens, the child's education is disrupted and the child feels it. Do you understand? Some of them don't get to even know where their parents are in extreme cases. And that affects them mentally, that affects them psychologically, right? So they need that support. They need that emotional security. They need that emotional support. They need support for their disrupted education and routines. They need help in processing what's going on. Because sometimes things just happen and the children don't really understand what is really going on. You understand? Like, for instance, in a time, maybe the trauma, especially from loss, violence, displacement. A child can't understand. I was living in a comfortable place 6 hours ago. All of a sudden, I wake up and I'm somewhere I don't even know, somewhere I don't even understand, and with so many people I've never been in the midst of. Do you understand? So children need that, and they need a safe place for at least play and socialize. Because children must always be children. That's one of my children always tells me. Just the children must be children, irrespective of what they are going through. They must always find an avenue to play, and that also helps them. It helps them to heal. It helps them to recover and all that. So if you are looking at maybe the women, let's look at the women. Let's move on, look at the women. So when we talk about the interventions, before we move to women, children-friendly spaces for play should be set up. Once a child can play, I'm sure that child's mind is quickly taken away from whatever it is the child is going through. That's the beautiful thing about children. Children are not like adults. You will be playing as an adult and what that thing is still on your mind. But the beautiful thing about the child is playing and that thing is thrown off, and all that. So, and then school-based counseling or peer support groups. If you're counseling them and it's like a school, a mini school, no matter where they are, it just helps them to, socialize with other children and all that. So let's move on to the women. Of course, when it comes to women, there will be women that are pregnant. There will be women in their, breastfeeding mothers. There will be women in their menstrual cycle, period. There will be all sort of women. Do you understand? So what do women really need at such times? Support for gender-based violence. They need this to be taken into consideration. Oh, as a woman, I just need to be safe. I want to be sure I am safe. I don't want to move into a place and then I'm being displaced into a place, and that place is even becoming more harmful. A place I'm taking into safety should not be even more harmful than where I'm coming from. You understand? So their common is support for gender-based violence, There should be no sexual assault, and there should be no exploitation, you know. Then they also need material mental health care. You understand? They need material mental health care. They have to be, the anxiety have to be addressed. Their prenatal depression, we've talked about that severally, that there is prenatal depression. You know, woman who has just given birth, a woman who is pregnant, there are a lot of things, systemic changes, hormonal changes, a lot of things, you know, are on the way. So that has to be taken care of too. Those are the things people want to, you know that, oh, I'm being this and this are being taken into consideration on our behalf. Economic empowerment and protection from discrimination, you know, from mental health issues and all that. So safe, supportive environment to express trauma. People just want to be heard. Once you're heard, and I know that once somebody is able to be heard and is able to talk, you have punctured some kind of pressure that you were undergoing. So when women's support groups are raised, where women can freely express themselves, it becomes, it makes people feel better. The women feel better. We also have, like we talked about, the refugees. What are their common needs? They need healing from this traumatic displacement. I'm telling you, sometimes you just have to try to flip the coin and, like, if I was in these people's position, how will I feel? I think that brings in empathy and makes us go all the way out to make sure we can do what we can do within our means. So healing from traumatic displacement, loss of family identity and security, they need those things, to need somebody to say, oh, look, I feel this with you. I understand that this is happening to you, and you will be fine. They need people to take care of their uncertainties about the future, because once something happens, let's say for the internally displaced people, the future looks bleak. It doesn't matter what it is that you're giving to them. It just, after this place, what next? The future always looks bleak. How do I stand to move from this place? How do I get resettled? Those are questions that agitate the minds of people. So, like, was it the female doctor? Sorry, I'm not used to her name, that said, people need to know that, look, whatever it is I'm going through, somebody knows that this is real. This is something I have to move away from. Then barriers, we also have things. Barriers to healthcare and stigma has to be taken into consideration. Then, of course, the men and the youth. I don't want to end this without talking about men, because a lot of times we talk about women, we talk about children, and the men are like, oh, even with the NGOs, a lot of NGOs talk about the female child. So people are now like, what about the men child? So men and the youth are also, their needs are also important. They struggle with loss of role. All of a sudden you see yourself, you don't know what to do to help your family. It's very traumatizing. You don't know, you all of a sudden you had a job, and because you are displaced, because something has happened, you just become unemployed. So you can't cater for you lose your identity, you lose self. Do you understand? Then substance abuse or violence, if not, if care is not taken, people tend to snap into that and all that. So then high risk of depression and suicide and all that. So those are the things, those are the needs, or the different strata, different demographic, needs and all that. I think I'm so happy I've been able to at least touch on the men gender, especially because men are important. Yeah. So thank you so much.
Doctor, thank you very much. I was thinking that because you spoke so passionately about children and you provided recommendations on how they can get care when they are met with emergency situation. You said same for women, talking about safe space support and the role of gender, in advocating care for and safety for them, healing and empathy. But you were also smart enough to talk about the male gender. I looked at the question very well, and I saw that men. No question was specifically addressed. The question was not specifically addressed to men. It talked about refugee, which was general, displaced persons general. Then specifically women. I was not saying there is a kind of maybe But thank God
No,
you were all encompassing to address all the issue, and we are quite happy that your recommendations was the recommendations were all encompassing. Thank you very much, Dr. Mfon, for that. Yeah. Yes. Let's go to the next person, and that should be going to Dr. Chinechere. This question has to do with technology and remote support. Dr. Chinechere, what role can technology, like telemedicine, mobile apps, social media, what roles can they play in delivering mental health support, reducing stigma, and reaching people in hard to access or remote emergency settings?
All right, thank you very much. Um, Technology has played a very huge role in making sure that mental health is now known by more people than it used to be some years ago. And technology has improved a way everyone or anyone who desires to have someone to talk to, like a therapist or something. He has brought these people to the doorstep of the people who can help them. Okay. So when we talk about technology and the support he has created more awareness for people to know. And another thing, he has created convenience for people to get service and information. So people don't need to go to a certain place to meet someone at a certain time, to get information about what is wrong. Some people can just feel like, okay, I think I am having some flashbacks on something that has happened to me, some trauma I experienced some years ago. Let me browse on what flashbacks can be. What kind of sign is that? Okay, I feel like I am not letting out my emotions out. I don't understand my emotions. Okay, can I just go to the internet, and then I'm browsing what can this mean for someone like me? So this has brought help to our doorstep, that we know that we can easily get information on things that we are not sure of when it pertains to our mental health, and it has drastically reduced the stigma that is attached to mental health, because people now have the information that I can get mental health evaluation without having a mental illness. It's just for me to be sure that I am okay, or I feel better, knowing that I'm okay, that nothing is wrong with me through the evaluation. And if we see sometimes online, we can see that some people go to rural areas and see people who are going through some difficulty in their life that's affecting their mental health, and they put it out there for other people to see, and by that means getting help for them. This is the strength of social media, the strength of technology, because without technology, nobody would know that this person is going through something like this in this particular place that is not easily accessible. But because of media, because of technology, someone was able to go there and make millions of people aware of this information. Like me in particular, I have seen some physical illnesses of late, which I wasn't aware of them. And this is because of the internet, the media and the technology has brought it to me, to my awareness. So this shows that technology has given us a very big edge on getting a lot of lives touched, and getting them healed from mental illness, or frustration, anxiety, struggles, and all that. So it has been a huge thing. So I think these things are a great support for mental health. Yeah.
Thank you very much, Madam Chime. That name is very difficult to pronounce. That's why I prepared.
Okay.
Beautiful angles. You have told us how we can leverage technology to assess health, mental health. Brilliant perspective and recommendations on that. We'll proceed with our next question, and that would be good. That question will be going to Dr. Umfom. Dr. Umfom, coordination. Let's talk about coordination and collaboration. So here we're going to be asking you, how can the often fragmented efforts of various stakeholders, governments, NGOs, local communities, and maybe international agencies be coordinated to create a coherent and comprehensive
I think you have a
mental
wrong
health
question. That's a wrong
providing
question.
services and response?
That's a wrong question for her.
Okay.
You should be talking
Oh,
about
sorry.
impact.
Okay, that should be. I'm talking about the impacts on aid workers, impact on aid workers, and that should be for Dr. Mfon, please. Dr. Mfon, what are the key strategies and responsibilities organizations must adopt to adequately protect the mental health and well-being of humanitarian aid workers and ensure they receive necessary support?
Okay. Thank you so much. Thank you so much. Yeah, you know, the aid workers, the humanitarian workers that come in to help people that that has to be helped, especially maybe internally displaced people, for instance. Do you know in the course of in their line of duty, they could also become traumatized because they see a lot of things, So they also their mental health also has to be taken into consideration. A lot of other things have to be taken into consideration. For instance, the organization has to take responsibility for them, even while on duty. Example, they have to accept responsibility for their staff safety. Sometimes a lot of things happen, violence could break up, a lot of things happen. So they have to take responsibility for their safety, their mental health, their well-being during and after deployment. So you have to integrate the staff well-being into all your assessment. So you don't just make an assessment of, okay, the children that are coming, the women that are coming, and your staff risk assessment is not taken into consideration. There has to be a program, designed to take care of their own, factor in their own risk, communicate transparently about the support that they are going to. So in that case, whatever they face in their line of duty, they have it at the back of their mind that they have a support system, and all that. Then prevention and preparedness before deployment. Those are responsibilities that the organization has to take. Pre-deployment screening and baseline. You have to have a briefing. This is what you may face. This is what you're most likely to face. You get their minds prepared, because there is not two situations that may be exactly the same. So that brief pre-medical screening, baseline well-being survey, you identify areas of vulnerability and accommodation needs, because they need to be well accommodated. They need to be well taken care of so that they will be able to discharge their responsibilities appropriately. You have that orientation. The organization has to take, responsibility for orientation and training, mandatory sessions on stress reactions. Because sometimes you're budgeting, oh, this is the number of people you're going to be handling, and all of a sudden the number becomes overwhelming. It's stressful. All those are stressors, and the people have to be trained, well orientated, that look, sessions of stress reactions, resilience. And I think earlier on I mentioned, staff stigmatization, all those things. People may not know. Somebody could come in and tells about a case, and you're just like, this is just stress, go and sit down, But matters should not be trivialized. All those things, during trainings and orientations, they are well informed, they are well equipped, psychologically, mentally, and otherwise. Then there has to be clear role descriptions and realistic expectations. You have to tell this is your role. This is where you have to cover this and this. When tasks are not distributed, everybody will just be, going around doing whatever they deem fit. But when they are well trained and their tasks are appropriately disseminated. This is your tax. This is where you're covering. This is what you. I'm not saying that in the course of duty, maybe people cannot match work, but then let somebody take responsibility. Those are things that the organization has to do. Family and household preparedness. You provide briefing and resources for staff, family members, because they are going to travel. Sometimes they will need to travel. They are going to contact pain. They are going to have, they need referral informations to give to people. You understand? In the course of duty, they will also refer people to other places. So they need to be well orientated. And then while on site, they also need support. These are responsibilities that organizations that are bringing them on board have to, take on. On-site support during deployment. You have to be able to accessible mental health services also for staffs, confidential counseling. They could become traumatized as well because they are human beings. It's not everybody that has the same mind that you could see something and it doesn't break you down. So at such times, somebody, you don't just say, oh, you're supposed to be a professional. A professional is also a human being, and things can happen, and the person has to be excused, and then her own mental health also has to be taken into consideration. So there must be time to rest. Critical incident protocols have to be, put in place. So all those things have to be factored in. You target clinical and psychological interventions. When this happen, first tier intervention, second tier intervention, everybody has to know, look, this is what can happen. Then you put leadership, culture, and supervision in place. Everything is not just jumbled up. What we are trying to say is the organization has to set structures. When everything is well structured, you see that even when it becomes overwhelming, because there is already a structure in place, people will easily be able to maneuver, you understand, using the structures that have already been put in place. So those are responsibilities. And then policies that have to be put in place, HR policies, benefits. People have to know what is in this for me, not necessarily as in grabs, but let me know that even as I'm doing this, I'm also being taken into consideration. Safety, especially security. Everything has to be integrated. There must be monitoring, there must be evaluation, there must be learning. The staffs are also human beings, so you can't throw them, on the line and just take care of other people while they put their lives on the line. So those are areas of responsibilities that the organizations have to, take on, build, and make sure that they are well, disseminated. So that's it. Yeah.
Dr. That was quite exhaustive. The list was long, So, I think the summary here would be that the welfare of healthcare work givers must it must not be overemphasized. That they must be taking care of their welfare.
Yes.
Very important. Thank you very much. But it's health in the health area, security in structure, HR policies, and the rest that you mentioned. Well done. Let's continue. We'll now proceed to the next question, and that's the question that has to do with coordination and collaboration. I was actually very eager to get a response on that. And yeah, so we're going to be asking Colonel Ijoma. So Colonel, how can the often fragmented efforts of various stakeholders, government, NGOs, and local communities, and maybe international agencies be better coordinated to create a coherent and comprehensive mental health program and support system response?
Yeah, so when I saw the question, what kind of came to mind or kind of hit me right away was the phrase often fragmented. So it's unfortunate that we have such a phrase on that. That's something that has to do with health, human life, that, sometimes people go to different areas when they should come together and work together to help. So one thing that also came to mind was what Anderson always say on CNN, keeping them honest. So media is very important in this situation, and social media as well. So in keeping them honest. So I know that most of the monies that NGOs use or those who work on, mental health come from some governmental agencies. So though it's called non-governmental, but then it's supported by the government. So in order to get them together, there should be need for the social media or the media itself to always be there so that we can keep them honest. So if we are putting our money in something, we need to know where it's going. And I also know that some of these stakeholders want to be noticed and want to be known. So if we can get them together, get them involved, so that they can meet every now and then, that would be great, because they want to be known. And they also, not only that they want to be known, they want to also share what they have done. Because in order to get more money from whoever supports them, they will have to, come together with others to share what they have, also how they have impacted people who have mental health, or how they have impacted people where there are destructions or war-torn zones. So and to also make sure that they come together as stakeholders, and also as stakeholders, the broader humanitarian efforts with stakeholders. So, and that would be like other humanitarian efforts, like what is China doing and what are they helping out with, or what is the United States doing and how are they helping out. And they're also empowering local leaders. It's important to understand that these things are happening in certain areas, and there are local people who are involved, family members, so empowering them and helping them, and even also respecting community resources, either into what the community has, or also helping use what they have in order to help those who have mental health. And I believe one of the speakers have also talked about culture, or cultural adaptation, making sure that they understand, cultural adaptation, all that. Written policies and planning, strength referral pathways, create 2 ways of referral on mental health. So, and also develop unified strategies. So a way that, all these people will come together and knowing what is going on and how they can focus on that particular thing, and making sure that everybody gets into it and taking care of it. So that's what I have, and I believe if there is media involved, the media will keep them straight and keep them honest, to make sure that the money that they have, that or they were given, that they are using it for what it's for. That's
Thank
all
you
I
very
have.
much. Thank you, Father. And these are very insightful perspectives, and if applied, I'm sure it really creates the cohesion and coordination in programs like this. Thank you once more. Let's move to the next question, and that should be for Dr. Chinechere. So here we're talking about long-term recovery and resilience. So I think, no, we're talking about addressing stigma and access, addressing stigma and access. So what are the most effective methods for combating the pervasive social stigma associated with mental health issues in emergency contexts, which often act as a major barrier to seeking and accessing care?
Yeah, thank you so much.
Welcome.
I would say is one of the most important effective method of combating this unwelcome social stigma is by educating the people. And when we talk about education or creating awareness, we have to educate the people in general. Then we have to educate the people who live with people suffering from any mental illness or any kind of trauma or whatsoever. So the people, the family, the friends, there should be some kind of educational awareness of things they should expect and how to relate with that person going through such a mental phase. And another person or persons we have to educate or create more awareness. People who are in the health sector who actually look after these people, you know, because if they are not aware of how to respond, what to do, and how they should relate with people who have emergencies, for example, they may go it the wrong way, and this will end up in the long run affecting the persons who are affected by whatsoever problem it may be in the long run. So the education has to be, or the awareness campaign has to be, cut across these three persons, okay, so that the effectiveness will be seen among people. And another thing is people creating like a support group for people to heal better, because when you are aware that someone else is actually going through the same thing or has been through the same thing that you are going through, it will help to stop the stigma of, okay, something is wrong with me, I should not speak up about my mental health problems, or I should speak up about what I'm going through because I might be stigmatized. Yeah, I might be stigmatized uh, 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 on my symptoms, So that support group will help people to be more open to how they feel and find better ways to get help. So this can actually combat social stigma that is attached to mental health and help people to access care, because now they can speak up and now they can seek help, because they see thing that should be done, not a taboo that they cannot say that I feel a certain way, or something is wrong with me, or I feel like I should get evaluated mentally. So this is going to really help. Another thing is to make sure that we see, or people see, mental health as part of healthcare. So mental health care, not just going to do your physical checkup. People should also find a time or see it as a thing that should be integrated into the health system, that people should go for mental health care just as they go to physical health care randomly. This will help them to evaluate their mental states and to see if there is anything that they have suppressed that might be affecting their lives that they are unaware of. So I think these are the methods that can be put in place to help combat this social stigma that has to do with mental health, and also break the barrier of seeking and accessing care when it comes to mental health in the future.
Breaking the barrier, education, and social care and support will make people it will break the barrier and make people to access social care. Thank you very much, Dr. Chinichirim. Next question would be on long-term recovery and resilience. This is about one of the last questions. And if I'll be happy if Father Ijoma can probably respond to this question in 1 minute, perhaps. I know it's going to be a very difficult task because there's another big question which has to do with funding and resource mobilization. That same question would go to Father Ijoma. So the first one, perhaps maybe we can use 1 minute to respond to it, Father. And the question is, beyond the acute phase, what interventions are crucial for promoting long-term mental health recovery and community resilience in populations enduring prolonged crises, conflicts, or displacement?
Mental health, you can hear me?
I can hear you,
Mental
please.
health is very important, and it's not supposed to be neglected. So we can, if it's neglected, it could lead to some other things like people committing suicide and all that. So those who have mental health needs to be taken care of every time, even at long terms. And the way that we can do that could be through peer support and even community-led initiatives. So knowing that those who have people that have mental health, they have to always continue to, go to them and make sure that they are okay. So how are you today? Do you need, or if they need to have mental health personnel to come, health personnel to see them, it's also important that they taken care of without being neglected at any time. So that's trying to cut it in a minute. Thank you.
Very well done. That was a very perfect, powerful summary, Father. So let's go to the last question, and that's still for you, Father. You probably wouldn't have to leave. Let's see your face. So the question is, funding and resource mobilization. This is a very big one. When it comes to money, everybody wants to listen, So funding and resource mobilization. So what innovative or practical steps can be taken by what innovative or practical steps can be taken to ensure consistent and sufficient funding is allocated specifically for mental health program and support system, moving it beyond a neglected component or humanitarian budget? And how can technology, okay, this is another attached question. How can technology and telehealth be utilized to improve mental health services in remote or resource limited disaster zones? Father, that's a double-edged question. It's a very big one. So I want to see how you can demystify this question for us, Father.
Okay, I think Dr. Chinechere already talked about how technology could be used. So
I think
technology, I'm going to the second one first.
Okay, that's fine.
Yeah, so technology, as we know now, in some areas is more advanced than others. But the world is almost like a global village now, where people can pay with their phones and all that, and money could be transferred through technology without anybody going to the bank. And so if funding is needed, technology could help to make sure that the people are funded. So through technology, those things can also be taken care of. But again, technology, like Dr. Chinechere has said, we can now, medical doctors, health doctors, behavioral health doctors, those that they cannot, or they probably have not studied, they have it on their palms. So they have apps that could help them reach out to those who have put it into their apps, or AI now that they use, taking over everything. So AI could help you research and help get what you need. So the first question, what innovation or practical step can be taken to ensure consistent and sufficient funding in allocated specifically with regard to mental health? Well, the government has to understand what mental health is. As a matter of fact, it's a very important thing that anybody who medical life should understand, that this is important for us, for humanity, to make sure that everybody's health, the holistic health of everybody is taken care of. We know about the physical health. We know about other health that then this part of us that you cannot see, it's very important. So it is the spiritual part of us that really hold physical parts together. So, and when we cannot, because we cannot see it, it can also destroy the physical part. So funding, making sure that if the government hospitals are funded, that they are also thinking about, the mental health issue, so that they know that the spiritual part goes into the behavioral health of every human being. It's what holds the physical part together. So, so it is important then that we incorporate that. In some places you have insurances, health insurance that could help with situations like that, and also localizing funding to different areas, or localizing funding where that behavioral health also part of the funding that they need in order to take care of the human health, is part of our health. So finance is important in every medical situation, but it's important that they understand that mental, the spiritual part, the part of mental is what really brings the physical part of a human being together. So that's what I have.
What a way to end. That's a very good one for Father, summarizing everything and relating it to the financial aspect of how help can be gotten. It's been a very interesting one, and we've actually overspent our time. We did not know, because time really flew, because of how interesting the topic is. Perhaps I should be apologizing to the participants, and I don't know, because I'm very sure for me, I really enjoyed even the extra time. And so we have been talking about the topic, mental health in humanitarian emergencies. And the people who have helped us to demystify this topic, who have unpacked this topic for us today, are Dr. Umfom Basi, Dr. Chinichirin Paul, and Reverend Father John Vianney Ijeoma, and they've done justice to this topic. I think the three words that are ringing in my head presently are enlightening, insightful, and educating. We also want to thank the participants for being here, because without you, we can't have this program. And we will continue to cascade these learnings to wherever people need them, so that they need this information, especially those who have mental health challenges. Kindly visit our website, www.cognitiveng.org. Next month, we're going to have another edition of this interesting webinar, and we really hope you make a date with us next month. But for now, we want to say goodbye and see you next month when we have the next edition. Thank you very much once more, everyone. Thank you very much, our panelists, and bye.
Thank you.
Welcome.
Thank you.